Meeting of the PPLER committee, and I'm calling it to order at 5:01. Is there a motion for that? No, I'm just going to put it down. One, and tonight we have our land acknowledgement is going to be prepared and delivered by Sarah Inch.
So as we gather here for this meeting of the Board of Health, I would like to respectfully acknowledge that we are meeting on the traditional lands of Nipissing First Nation within the Robinson Huron Treaty Territory. This land is part of the Anishinaabeg Nation, and we recognize the enduring presence of the Anishinaabe people who have cared for these lands for generations. I'd also like to take a moment to acknowledge the traditional territories where my family's story begins. My parents were born in Hamilton, which is situated within the traditional territory of the Haudenosaunee Confederacy and Anishinaabe peoples, as well as Kinsella, Alberta, located within Treaty 6 territory, home to the Nehiak Cree, Nakota Sioux, and Métis peoples. These acknowledgements remind us of our shared responsibility to honor the lands and the peoples who have stewarded them since time immemorial. May we continue to build relationships of respect, equity, and reconciliation as we move forward in our work.
Thank you, Sarah. We're going to move to item 3.0, which is the agenda. That's the one here that be resolved that the Personnel Policy, Labor, Employer Relations Committee agenda dated November 27th, 2024 be approved. And do I have a mover? Marion? And seconder? Karen? Okay, and I'll take a recorded vote. Rick Champagne,
Yes.
Karen Cook,
Yes.
Blair Flowers,
Yes.
Hugh, Sarah,
Yes.
Jamie McGarvey. You have to get it. Okay, Jamie Restool,
Yes.
Tim Shepherd. Yes. Marianne,
Yes.
Catherine Still,
Yes.
Morris,
Yes.
and David Wolf.
Yep.
Thank you. That is carried. The next order of business is be resolved that the minutes from the personnel policy labor, but oh, did I miss that one? Any conflict of interest to declare?
Thank you, Dave. Yep.
None? Okay. If it comes up, obviously you can identify it. Okay, so let it be resolved that the minutes from the Personnel Policy, Labor, Employer Relations Committee meeting held on April 24th be approved as presented. Have a mover? Right. Seconder? Catherine's on. No, you, usually my neighbor. And I'll call for recorded vote. Rick Champagne,
Yes.
Karen Cook,
Yes.
Blair Flowers,
Yes.
Sarah Inch,
Yes.
Jamie McGarvey, Jamie Restool,
Yes.
Tim Shepherd,
Yes.
Marianne,
Yes.
Catherine,
Yes.
or Switzer,
Yes.
and David Wolf.
Yes.
Thank you. That is also carried. All right. Next part of the agenda. Okay, so at the call of the chair, date to be determined and place to be determined, I think it's probably be here. But I understand is that there are a number of meetings that are coming up because of negotiations. So keep our eye on the emailing this, right? Okay.
Sorry, Joe. Just a point of order there.
What's that?
5.0.
Oh, okay.
Just so no. One other thing.
Are you an editor, Dave,
Yeah.
by chance?
Okay.
So just that there's 2 5.0s.
I think it's been updated.
Oh, okay. Thank you.
Okay,
That's fine.
all right. Any business arising? Okay, all right. 8.0 is that the personnel policy employee labor relations committee moving camera at 5:06 p.m. to discuss item 8.1, a personnel matter about an identifiable individual. Do I have a mover? Sarah? Karen? Okay, and we'll take recorded vote. Rick?
Yes.
Karen?
Yes.
Blair?
Yes.
Sarah? Yes. Me, yes. Jamie McGarvey?
Yes.
Right. Jamie Restool?
Yes.
Tim Shepherd?
Yes.
Marianne?
Yes.
Catherine?
Yes.
Morris?
Yes.
And David?
Yep.
That's carried. Hey. performance appraisal of the medical officer of health, executive officer, needs to be completed as per the Board of Health bylaw section 4, hashtag 54 semicolon, whereas, am I saying all those things? Whereas the ad hoc performance appraisal committee was created in 2024 to conduct a performance appraisal process, and whereas a performance appraisal survey was sent to 26 individuals, which included all Board of Health members, all executive team members, selected managers, and staff, and the responses, comments were summarized in themes. Now therefore, let it be resolved that the Personnel Policy Labor Employee Relations Committee recommend that the ad hoc committee of the Board of Health Medical Officer of Health Performance Appraisal Committee conduct the performance appraisal of Dr. Carol Zimbalati, Medical Officer of Health, Executive Officer, and furthermore, that it be resolved that the Personnel Policy Labor and Employee Relations Committee recommend the Board of Health approve remuneration for the activity in accordance with the Board of Health bylaw, section 5, or is that 6 rather, hashtag 79. And did we want to, just as a clarification, did we want to add it to come back next board meeting with something? Would that be part of that?
I would
No?
just bring it forward.
Okay, all right. Do I have a, thank you, motioner? Morris, thank you.
You see Jamie's got his hand up there.
Jamie McGarvey? All right. Call for a quarter vote. Rick Champagne,
Yes.
Karen Cook,
Yes.
Blair Flowers,
Yes.
Sarah Inch,
Yes.
Jamie Lowry, Jamie McGarvey. Yes. Jamie Rastool,
Yes.
thank you. Tim Shepard,
Yes.
Marianne,
Yes.
Catherine,
Yes.
Morris. Yes. And David Wolf. Sure. That's carried. Okay. Let's see, have any new business? Seeing none. Adjournment at 5. Thank you.
Thank you again, Jose.
Have a good evening.
Thank you.
When are you
Thank you.
finished? When is your last, like when are you done?
Not telling.
Okay.
Ain't seeing.
May 25?
Is that open, Jose?
Okay.
Ready to go? Okay. Well, thank you very much, everybody, for coming out tonight, and very good meeting, Chair. Thank you very much. And so we'll call the meeting to order. A mover and a seconder. Moved by Catherine.
We don't need to. That's the approval of
Oh, sorry. Here we go. Number 2, item 2.0, approval of the agenda. Catherine Still.
Yep.
Second by Marianne Stickland.
Meet Marianne.
Any discussions? No? Okay. Moved by Catherine, second by Marianne. Recorded vote. Rick Champagne, yes. Karen Cook.
Yes.
Blair Flower.
Yes.
Sarah Inch.
Yes.
Jamie Lowry.
Yes.
Jamie McGarvey.
Yes.
Jamie Restool.
Yes.
Tim Shepard.
Yes.
Marianne Stickland. Catherine Still.
Yes.
Or Switzer.
Yes.
Dave Wolf.
Yes.
Carried. Next item, conflict of interest. If you see something come up, let us know. Address it. Approval of the previous minutes, 4.1 of October 16th. We need a mover.
I'll do it.
Tim Shepard. Second by Karen Cook. Any discussions on the minutes? Seeing none. Important vote. Rick Champagne, yes. Karen Cook.
Yes.
Blair Flower.
Yes.
Sarah Inch,
Yes.
Jamie Laurie,
Yes.
Jamie McGarvey,
Yes.
Jamie Restool,
Yes.
Tim Shepherd,
Yes.
Marianne Stickland,
Yes.
Catherine Still,
Yes.
Morris Switzer, Dave Wolf.
Yep.
Carried. Next item is Board of Health and Camera meeting from October 16th. Need a mover and a seconder. Dave Wolf,
Amy Restool.
Jamie Restool. Obviously, we can't discuss it. It's for our information. Need a recorded vote. Rick Champagne, yes. Karen Cook,
Yes.
PPLER Flower,
Yes.
Sarah Inch,
Yes.
Jamie Laurie,
Yes.
Jamie McGarvey,
Yes.
Jamie Restool,
Yes.
Tim Shepherd,
Yes.
Marianne Stickland,
Yes.
Karen Still,
Yes.
Catherine Still. Did I say that? I'm sorry.
I did.
Sir, Dave Wolf. I finally said it. I apologize for that.
Those are my nightmares.
Yeah, you don't want to be a Karen.
All right. Item 5.0, date of the next meeting, December 4th, 2024, to be determined. Yep, Nipissing Boardroom. Okay. Business arising. Report of medical officer.
And so it was included in your package and
Mhm.
it's available for questions.
I don't see any questions. Oh, there you go, Sarah Inch. Okay.
So I noticed that there is an increase in syphilis. Is that right?
It's Canada-wide. And I'd say the populations
Dave,
that are affected are shifting.
did you have
We are seeing more of women of childbearing age being impacted. That, of course, puts the population at risk in terms of congenital syphilis, which can also be very severe. So, yeah, we have a number of initiatives in place to try and reduce incidents, but it is a national phenomenon.
That's why it's.
You.
Next is Morris.
Yeah, thanks, Doctor. I had a couple of questions. The smudging room feature is in place. What was involved in that?
It's mainly building and maintenance, so HVAC.
And the can I get the cost of the training, the Indigenous cultural safety training? Can I get the
I
cost?
believe that was shared in an email. I don't know that off the top of my head.
All right. Maybe we can get that after. I don't remember seeing that. I asked about it, but I don't remember getting a response, not from you, but from Ashley, I think. Thanks.
Dave, I believe, is next.
Just a couple of questions, but a follow-up to Sarah's question. Is there a direct correlation between the rise in syphilis and HIV to substance abuse?
There is, so the HIV that we're seeing, that's mainly in the Parry Sound area. I would say that the risk factors with the population, they are interrelated. Yeah, so with this, I think what we're seeing, it's not so much that same population. Previously was more in the population of men who have been, but we are seeing that shift, as I said, to women of childbearing age. So it's not necessarily the same risk factors with both increases.
The strategic planning, so page 7 of 14, it mentions next steps is to form working groups, et cetera, et cetera. Will there be, is it your plan to give updates to the board on a regular basis?
Yes.
On those, okay, perfect. Thank you very much. Further down, in regards to whooping cough, I'm assuming that the majority of those cases are children and youth, or are they spread out across the population?
Yeah, I would say it is more spread out. There were a number of, 65 plus
Right.
impacted as well. Of course, we're only seeing the tip of the iceberg and of who's being tested for it, because a lot of people with a chronic cough or they don't go for testing. So perhaps what we're seeing in terms of people coming forward for testing, it might be skewed towards the more elderly population as opposed to what's actually out there. But
Are you finding that concerning?
so the local cluster of cases that has diminished. So it is a cyclical phenomenon in that every kind of 3 to 4 years, 4 to 5 years, there tends to be an increase in pertussis. And so, no, I would say that it's kind of on trend with what over the long term in terms of pertussis.
And to your level of concern about the group A strep, those numbers seem high.
Yes,
and are we seeing more antibiotic resistant? Like, are we really feeling like this is something where we're going to have an ongoing problem? And in specific terms, like to our district?
Concern. I would say we are seeing some more resistant strains, especially that M type 1 that is coming out of the UK. There is a concern there that if we get these more hypervirulent strains that are tending to be a bit more resistant to drugs, that we could see more fatalities related to.
Yeah, that was worrying when I read that.
It's the development of invasive group A strep that comes from quite common group A strep, which isn't invasive. So if you have more resistant strains, there's more likelihood that you are going to get more of the invasive case, which are the more serious.
The on page 9 of 14, the seasonal vaccines. Are we seeing people getting their COVID-19 vaccines, or are we seeing decreased numbers?
I don't have the numbers for our region, but
Anecdotally,
I'd say, decreased numbers. I'd say, the 65 plus, we're looking at about 25%.
I think that my concern with those when I read that was that there seems to be this belief that COVID-19 and COVID-related illnesses no longer exist, that we've cured it, that it's not a problem anymore. And I'm just wondering if there's sort of, not trying to put more work or tell you what to do, but if there's a plan in place to communicate that COVID-19 actually has not gone away, that it's still pervasive and it's still a problem, and are encouraging certain age groups and others and whatnot to maybe go and get their COVID-19 vaccine.
I mean, I would definitely say the target population that we really want to get their shots is the 65 plus, as well as those who are at higher risk for other reasons. Right. There is a fair amount of natural immunity or immunity in the population from previous vaccinations and from previous infections, but those at the highest risk of bad outcomes are those who are more elderly and with chronic medical conditions. So there is a lot of messaging out for in terms of that, both the messaging that we do locally, but also at a provincial level, also at a federal level. I would say it's always tenuous each year now whether we are going to get any specific funding related to COVID vaccination efforts. So it does. We do have to be careful about how we spend funds, and we try and do as much as possible with unpaid media, though we did invest in some paid as well.
Yeah, so push it on social media channels, et cetera. Okay, good.
And through partners as well.
Yeah, of course. I maybe not see some of that, so that's why I was asking whether or not there's a bit of a push on the grade 7 vaccine program, and it just brought to mind that at one point the numbers of school children that had missed certain vaccinations because of COVID, because of the pandemic and school closures and so forth, are those numbers back up to pre-pandemic numbers, or are we still trying to catch up to some of those vaccinations?
So I would say that the catch-up efforts in terms of reaching all those kids, we've done that, okay. But we are seeing generally more vaccine hesitancy, which has impacted the percentages of school-age children who have received the recommended vaccines.
Okay, thank you, Chair. Thank you.
Any other questions? One thing that pops up is I don't even think the province even calls it COVID anymore.
It's really about respiratory illness.
Exactly. So the word COVID-19 doesn't even show up anymore. Yeah.
Morris's question.
Oh, Morris.
Morris, Chris Bowes, the Healthy Living program manager, sent you an email. The cost for the training is at roughly $395 a person. So the cost itself was around $7,000.
Thanks very much. Thank you.
Any other questions for Dr. Zimbalati? Thank you for the report. Next one is 8.1, Personnel Policy Employee Labor Relations. Need a mover and a seconder? Tim Shepard and Jamie McGarvey. I'll read the motion, and if there's any questions at the end, we'll. Whereas the performance appraisal of the medical officer of health executive officer is required as per Board of Health bylaw section 4 comma 54, and whereas an ad hoc performance appraisal committee was created in 2024 to conduct the performance appraisal process, and whereas the performance appraisal survey was sent out to 26 individuals, including all Board of Health members, executive team members, selected managers and staff, with response and comments summarizing into the theme. Therefore, to be resolved that the recommendation of the Personnel Policy Labor Employee Relation Committee that the Board of Health for the North Bay Parry Sound District Health Unit approve the performance appraisal survey result completed by the Medical Officer of Health Performance Appraisal Committee, Dr. Carol Zimbalati, Medical Officer of Health Executive Officer, and furthermore, it resolved that the recommendation of the Personnel Policy Labor Employee Relation Committee that the Board of Health for North Bay Parry Sound District Health Unit approve the remuneration for the activity in accordance with the Board of Health bylaw section 479. Any discussion? Obviously. Okay. I'll ask for recorded vote. Rick Champagne, yes. Karen Cook?
Yes.
Blair Flower?
Yes.
Sarah Inch?
Yes.
Jamie Lowry?
Yes.
Garvey?
Yes.
Jamie Restool?
Yes.
Tim Shepard?
Yes.
Marianne Sticklin?
Yes.
Catherine Still?
Yes.
Boris Switzer? David Wolf?
Yep.
Carried. Thank you for all the time we put into this, and okay. All right, Ashiko. New business or correspondence first. Thing is there if you want to look at it. New business 10.1, Association of Local Public Health Agency, Alpha 2024 Fall Symposium Summary Report for attendees.
Yeah, so Sarah and I contributed to providing a summary of Alpha and can answer the questions if you have any.
Does anybody have questions for Sarah or Dr. Zimbalati?
Just wondering if you want to maybe articulate more what the valuable insights into the current political environment are.
You want to be scared?
No, I do think that it is
Nightmares.
a fluid kind of thing, and I'm just wondering, where are we today that, either things that have changed from other discussions we may have had?
I would say that one of the key takeaways from that discussion.
You don't
is
have to be careful.
We do have a populist government, and that perhaps evidence and evidence-based interventions are not necessarily what interest them the most. It's really the perception of the effectiveness of interventions as opposed to like in terms of public opinion, as opposed to the evidence. So public health has to be aware that in our advocating that we really need to look at the outcomes that are of interest to this government and connect the dots between what we're doing, especially at the preventative level, which I don't know if those dots are necessarily being connected. So we need to do
That rumor then that the province is considering having public health units sell beer and cigarettes to raise money, that's
Oh,
Well, it's easy to find the beer now. Have at her.
all right.
Not.
Any other good questions for Dr. Sarah Inch? Pertinent to this.
Conversation.
Just a follow-up,
Yeah.
if I may. Considering the changes that we're seeing south of the border, and a rush to try to appease the new administration on a number of levels, is this another area where we're going to see policy direction potentially shift based on thoughts and concerns in the United States as opposed to what actually works well or needs to be working well for Ontarians?
I mean, I think there's always that concern. Definitely, we saw that with the previous administration. That, in my opinion, we had a more divided, public opinion. It was yeah. I think there is a risk that some of that could influence political agendas here.
Yeah, it's going to be a different world for sure.
Yeah.
Any other questions? Dave, so much and thanks for the report. Move on to 10.2. Need a mover and a seconder. Moved by Jamie Laurie, second by Blair Flower. I'll read up the motion. Whereas the Board of Health of North, let me start all over again. The Board of Health of the North Bay District Health Unit was presented on October 16th, 2024, with recommendations for the organizational review confidential presentation report for the information purpose. Therefore, it resolved that the Board of Health of North Bay Parry Sound Health Unit hereby declares the following position redundant as of January 1st, 2025. Executive Director of Human Resources. And it be further resolved that the following position shall be created. Executive Director of Organizational Effectiveness, and it be resolved that the hiring process for this position will be done expeditiously. A discussion on the motion. None? I'll ask for a recorded vote. Rick Champagne, yes. Karen Cook,
Yes.
Claire Flower,
Yes.
Sarah Inch,
Yes.
Jamie Laurie,
Yes.
Jamie McGarvey,
Yes.
Jamie Restool,
Yes.
Tim Shepard,
Yes.
Marianne Sticklin,
Yes.
Catherine Still,
Yes.
Morris Switzer, David Wolf.
Yes.
Board of Health bylaws. Need a mover and a seconder. I have Jamie Restool and second by Sarah Inch. Whereas the Board of Health received and reviewed written notice in November 27th, 24, agenda package of proposed revision of the Board of Health bylaw as follows. Section 1 agenda. The medical officer of health executive officer shall be prepared for the use of the members at a regular board meeting, health meetings, and agenda to follow items. Call to order, land of acknowledgement, approval of agenda, conflict of interest, approval of previous minutes, date of next meeting, business arising, report of medical officer, board of committee reports, correspondence, new business, in-camera adjournment. A land acknowledgement is required to read after the call to order in the first meeting of the schedule. Now therefore resolved that the Board of Health approves the provided revision to the Board of Health bylaw regulating the Board of Health as presented. Discussions on the motion?
Chair, may I actually make a friendly amendment to this? I just in reading it now that with the asterisk there, land acknowledgement is required to be read. Perhaps we can change the word read to provided.
You're talking about read and okay, read. Provided. Okay.
We're offered.
Mhm.
Okay, Jimmy Restool and Sarah Inch, are you happy with the friendly amendment?
Yes.
Yes.
Thank you. Any other discussion? Oh, Morse?
Yeah, I went through the bylaws. I'm having insomnia, so I went through the bylaws to help me sleep. And
did it?
And I came across a couple things. I know this isn't pertinent specifically to this change, but maybe we should take a look at it. Number 49, and I read this several times. Number 49 says all board members are members of board committees. And then item 50 says members may attend in a non-voting capacity any committee of which they are not a member.
There can also be ad hoc. The committee that was struck
Page 40.
for my MOH evaluation.
Mhm.
So that you could attend as a
Just point of order, where are you getting this?
right here.
49, okay, got it now.
Yeah.
Straighten him out, Ashley.
In that one, yeah.
And I'm on number 83. I am not lobbying for a higher honorarium. I'm not here for money. But is it a coincidence the amount of money that board members are receiving is $1.20 more than minimum wage for 4 hours? I just thought that was kind of interesting. Anyways, I'm not lobbying.
Sounds like lobbying. Sorry, Morris.
Oh, and number 94, sorry. It doesn't, well, it wouldn't in the bylaws, but some idea about the limits. It's credit cards for the organization. What's the current limit for?
I would have. I think it's 10,000 on the card, but I would have to ask Isabel that. It is something we're looking at.
That'd be part of the procurement bylaw of some sort, like just can't spend it. There's kind of rules even around that, right?
Oh, for sure.
Yeah, it's right after the procurement item. So thanks, Chair, for.
So was this a one night thing or all weekend? Thank you, Morris, for bringing that forward. All right. No other discussion? We'll ask for a vote. Or Rick Champagne, yes. Karen Cook,
Yes.
Blair Flower,
Yes.
Sarah Inch,
Yes.
Jamie Lowry,
Yes.
Jamie McGarvey,
Yes.
Jamie Restool,
Yes.
Tim Shepard,
Yes.
Marianne Stickland,
Yes.
Catherine Still, yes. Morris Switzer,
Yes.
Dave Wolf,
Yes, sir.
carried. In camera, I believe we got anything?
10.4.
10.4. Oh, yes,
There's no motion.
there's no motion. Okay, third quarter medical officer of health expenses, July 1st to September 30th, 2024. Are we allowed to look at them? No issues? Read that one, Morris?
No.
Thank,
Right, Morris?
thank you. Camera, nothing. Adjournment? Thank you, everybody, for coming out tonight. I know it was a long meeting.
Just see if there's any media.
And okay, and I'll just keep talking in the meantime. And we went overtime tonight because of Jamie Lowry and his committee. Otherwise, committee was on time.
Oh, blow. No media inquiries.
Meeting Christ. Okay. Again, thank you, everybody, and we'll see you next week.
Thanks.
Thank you.
Thank you.